I'm Dan Kudo, longtime member of the California Society of Health System Pharmacists, or CSHP. We're fortunate today to have our 2023 Pharmacist of the Year Award recipient, Dr. Marilyn Stebbins, with us today. Welcome, Dr. Stebbins.
Thank you. It's an honor to be here.
The Pharmacist of the Year Award is awarded annually to a CSHP member who has made significant and sustained contributions to pharmacy practice in California. Dr. Stebbins, can you provide us with some of your background in pharmacy?
Sure. Pharmacy has been very, very good to me. I started my practice with a residency at the UC Davis Medical Center many years ago, and followed that with a job I never anticipated as an ambulatory care pharmacist at the VA in Sacramento, because I really didn't have any ambulatory training. So I was very lucky to get a position that was new and innovative and allowed me to actually jump into patient care right away. I spent 7.5 years doing that. And then I took students and residents during that tenure, and then actually became faculty with the UC San Francisco School of Pharmacy in another very novel position I never would have anticipated within a medical group. So I was placed 90 miles away from UCSF into a medical group to teach physicians how to prescribe cost effectively. And it was quite a change in my career. And it did lead to them finally saying, you know what you're talking about with telling us what to do, just do it yourself. So it turned into a patient care activity. And I spent 17 years at that site developing programs. I then went back to UC San Francisco to the main campus for the end of my UCSF career, and spent my time as the Chief of Innovation for the Department of Clinical Pharmacy, developing new programs in the ambulatory arena and in the community arena. I started working for a cardiovascular healthcare startup that I worked with at UCSF in an innovation capacity.
How would you characterize perhaps an ambulatory care practice for a medical group as maybe different than an ambulatory care practice that you spent time with at the VA?
Boy, that was a huge difference. One, when I was at the VA, most patients didn't pay anything for prescriptions. And so the whole idea of what a prescription costs, how to prescribe cost effectively, et cetera, never really entered the picture. I also did full-time patient care in clinics at that point. And when I started in the medical group, these physicians had no idea that I could be a practitioner. They thought I was just there to help them develop medication management programs and to help look at their contracts and figure out how they could spend less money on prescription drugs, which was never really my intent. However, we all learned a lot, and it was quite a different practice because I was dealing with providers in the early days until they discovered that I, in fact, could take care of patients myself and be an extender for them. And I began my clinical practice within the medical group after several years of doing utilization management, because they now understood what a pharmacist could do.
Why would a pharmacist want to be a part of CSHP?
Oh, I can give you many reasons, but I'll give you my personal reasons. And from the time I was a student, being a member of CSHP was my lifeline to networking and meeting new and innovative pharmacists doing interesting things. When I was in school, I didn't really know what I wanted to do for my actual practice setting. At that point, I thought, okay, I'd probably be a hospital pharmacist. I'd do a residency as a general residency and be a hospital pharmacist. But the CSHP gave me the opportunity to meet people in many realms of pharmacy and to learn what they were doing. And I think on top of that, I honestly think networking is the key factor to CSHP. It's the people, and it's their experiences that they share with fellow practitioners, students and residents that help them grow. So I think that along with the continuing education and the meetings and the policy, probably for me, the most important thing was the networking. I think for the future of pharmacy, one of the most important things is the policy aspect of CSHP and getting involved with where the profession goes. And being a member of CSHP allows you the ability to help guide the path and the future of pharmacy.
What are the most rewarding things you've done as a pharmacist?
Probably the most rewarding things have been going into practice settings that had never had a pharmacist and proving the value and the worth of the pharmacist in very different capacities than practitioners or patients ever expected. My patient population that I would say has provided me the greatest satisfaction has been the underserved and the elderly. I think that I started a program within the medical group called the Price Clinic, which was really to help the elderly before Medicare Part D afford their medications, and to do medication therapy management long before it was a Medicare term with patients to get them on the right drug and help them afford the medications, because the right drug is the drug they can take. So the elderly and the underserved have always been the populations that I have gravitated to. And I find that that's where I've gotten my greatest rewards.
What do you see as the future for pharmacists and pharmacy as a profession?
The profession of pharmacy is wide open, but I also firmly believe that when opportunity knocks, you've got to throw that door open wide and jump in with both feet. And right now we're at a pivotal time in pharmacy because we're on the precipice of provider status, although many people will say we've been looking at federal provider status for a long time, but I do think we're on the brink of that to actually get our services paid for on a more consistent basis. But I think we're also at a pivotal time when people are talking about hospitals, downsizing, care going into the ambulatory arena, community expanding. And I think we have to embrace that. I think we have to really, as pharmacists, go to where the patient is. And that is in many different settings. But people live in their communities, and many people want to be seen in their communities. And there's a huge opportunity if we are going to see inpatient facilities downsize and more care happen in the community. We're going to have to see more pharmacy care in the community, both in community pharmacies as well as in the ambulatory arena and in non-traditional places. We are looking at virtual care. We're looking at street medicine. We're looking at all of these avenues. And I want to say that the future is bright as long as you take the opportunities that are out there and look for them. Meet people that are doing these really innovative things and don't be fearful. I always tell people that you oftentimes fail before you succeed, and fail fast, pivot and move on and look for your next opportunity. Pharmacy is ripe with them.
Thank you, Dr. Stebbins. I'm sure your stories will inspire other pharmacists to strive for excellence in their pharmacy practices. Thank you very much for sharing your insights, Dr. Stebbins.
Thank you, Dr. Kudo.